Here in the hospital now, we only have one cannula. It's this green one. It might be white now. It changes based on who supplies it. It is high flow and low flow. So we only need one. You can take this all the way up to 15 liters if you have to. If you are going to put it on a bubbler, most you guys don't have time to do that down here. This bubbler can go up to 6 liters. You can get one that goes above that from us, so just to humidify it. Okay. Nasal cannula. Simple masks. Anesthesia loves these. RT hates these. So we got these removed from all the floors. You can only get a simple mask down here. The reason we don't like them is the staff tends to think they can wean these and they just turn the flow down, and then all of a sudden your patient is lethargic and they're rebreathing their CO2, and not a good idea. So an RT would tell you that this can't go below 5 liters. Anesthesia will tell you you can take it down to 2. I would not advise that. So down here, you can do they'll do what they want. We got the oxy mask placed in all other units in this hospital for that reason, because this can go from 2 to 15 liters. They don't like it because they don't feel it does anything. It also doesn't provide their patients with a dirt nap later when they've been an RRT call. I mean, it's bad. That was the reason that we did it. Non-rebreathers. This is the best O2 delivery source to put on your patient if they are desatting and having a really hard time. This provides almost 100% FiO2 when hooked up to 10 liters or above. I would tell you that the easiest way to do this is to put your fingers in here and the bag will fill real quick, and then you can put it on. The bag needs to stay filled. It doesn't need to be, hanging completely inflated, but it's not supposed to be deflated. So this is a nice one to do while you're calling us to come say, hey, what's going on with this patient? Veni mask. A Veni mask is available from RT only. SPD does not stock them. The reason we like them is we use this for transporting trach patients, okay? It comes in a bag with a mask, and you do have patients that you can do up to 50% O2 on this. It's just, some people are mouth breathers or it's more comfortable, but we can set that up. But basically what we use this for is the trach patients, because we do not transport trach patients on a cam, okay? It's just not appropriate. The water will lavage them, it's not appropriate. So all the trach patients in the hospital, before they go anywhere, we make sure that they have a Veni barrel in their room. And along the side of this, it gives you liter flow is either 3 or 6. That's it, 3 or 6. But it gives you FiO2 markings of where you need to be, and you just turn it to that one. Set it at 3 for 28%. If you need 50 or 40%, you set it to 6 liters. But it just is a little dial, and it just clicks into place, and it can only go where it needs to go. You just keep turning it until it actually lines up. This one's kind of worn away, but the new ones come, and it's got an arrow, and you can see, and it just lines up with the lines, and that gives you whatever FiO2 it says on that line.
Is that a kit?
It comes in a bag, yeah, and you get it just from RT. RT will, again, we are the only ones that carry Veni masks for that reason.
And you just hook it directly to the trach mask.
To the trach mask.
Right.
So this just goes right on the bottom of the trach mask. This just goes to an O2 connection. No humidification, just straight O2. Yeah, you don't use a bubbler on any mask, period. If it's a mask, don't put any water on it unless it's the can, and that's just to a trach mask. Any other O2 questions? O2 is pretty easy. Trach says, asked to speak about a few things about trachs. Basically, when you guys see trachs, you're going to see cuffed trachs, because your patients can't go into anesthesia without a cuffed tracheostomy. So here we use Shileys for that purpose. The cuffed ones come in 2 different kinds. So this is just a straight cuffed trach. cuff's inflated, balloon's inflated. This is the inner cannula. It comes in and out. It clips onto the side. You have to have the inner cannula in to suction. Okay. This is a fenestrated trach, which is a step down from this. Typically, we don't even do this anymore. They just downsize the trach, and then once we cap it and they can breathe on their own around it with the cuff deflated, we'll just pull it. But there have been, I mean, they used fenestrated trachs for many years to wean people off them. This one twists and the inner cannula comes out. This one has also a non-disposable inner cannula. It is green. Don't throw that one away if you see it. But for the most part, all of your cuff trachs down here, these inner cannulas are disposable. They come directly from SPD, and that's not a problem. But if you get one and your SPD is giving you a hard time on what you need, call us. We can figure out what you have and what you need. Trachs, other than that, I mean, we don't see that many kids anymore. Their trachs are all uncuffed. So, other than that, any other trach questions? It's a long shot whether or not you see them or not. I mean, they're here. We spend there's a lot of newer trachs that they have been using that are also made by Shiley that they're longer. Those are specifically made for Select for the most part. They stock their own. So if you do get a patient down here that doesn't have a Shiley and you have a question, call us. I mean, there's still probably 10 people that we see routinely that have Jackson Pratt trachs in. Those are metal. So but typically they pull those too. Any other questions?
With the oxygen delivery, we just talked about in pre-op, I can't provide a department meeting for anesthesia. So if anesthesia comes in, brings the simple mask in on the patient and puts it on 2 liters, just be aware, increase that to at least 5, 8, just to make sure that we're not, making our patient have a dirt nap.
You just can't, I mean, it's really difficult for that. I mean, it depends on how they're breathing, what their actual minute volume and tidal volume is. I mean, 2 liters might be sufficient for somebody, but it's not for everybody, and that's where it's kind of like the rule of the game is I like to say 5 liters. You're on the safe side there.
Is Rosenthal's from last night?
Light costs to run.
Oh, the specimen itself? No,
Yeah.
I truly have no idea.
Okay.
That's all been taken completely out. I mean, I could have told you when we were billing for them, but unfortunately, we don't even see any revenue whatsoever from any of the gases or lights that we run.
Okay.
So
Sounds good.
it all goes through lab.
Okay. All right. Thank you so much
You're
for
so
coming.